Hello, everyone. This is Dr. Kyle Olson at Chiropractic First of Rockford, and I want to take a minute today as part of our Thought of the Week series of videos and ask a question about newborns being adjusted. And the question is very simple. Do you feel or do you understand why a newborn child should be evaluated by a chiropractor and possibly likely adjusted? If you've somebody that's been in our clinic, you probably have seen that we are a family-based clinic, and so we actually see many children of varying ages. And oftentimes, new parents will bring in their newborn child. We've had the pleasure of seeing moms and dads bring them in even on their way home from the hospital. And overwhelmingly, when they are evaluated in the office, and if they do receive an adjustment, it's not because there's a health concern or they were born with a condition or they had even necessarily a traumatic birth. They're brought in because the majority of the patients that are here want to make sure that their child has the same head start in life that they were given when their body was forming, which just means that any kind of subluxation or any interference that was delivered to that child as they were coming through the birth canal and as they were brought into the world is removed as quickly as possible. The reality is the birthing process can be traumatic, and even the most complication-free traditional birth can put between 60 and 90 pounds of pressure on that child's neck as they're brought through. And that's even increased with alternative methods of delivery or assisted methods of delivery as well. And so while not every child becomes subluxated or has a shift or a pinch in their spine because of that, for many it does. And it doesn't always manifest as a symptom right away. In fact, kids are very resilient. And so most of the time they don't come in with a ache or pain. They're not crying. They're not colicky. You know, the limited ways that a child can express that they're not in good health. But again, they're brought in for general health and wellness. We do see some children that do come in with a symptom though. And of those, especially newborns, the most common things we would be looking for is colicky. Sometimes there are issues with latching even that can be resolved with chiropractic care and maintaining the health of the upper back and the neck of that child. If it's not comfortable for them to be in a turn position to latch, oftentimes that can be resolved with a gentle adjustment to resolve that. As they age, not just newborns, but as they start to age and become older, when you see issues with maybe the way that they carry their head, the way that they are learning to crawl, things like that. If you notice asymmetry in their movements, sometimes that can be an early sign of a subluxation or a misalignment within their spine. As they age even more beyond that, now we're looking at things often like frequent colds and flus or earaches. So at different stages early on in life, there are signs or clues that their health is not as optimized as it can be, but for newborns, oftentimes there isn't that. And so I would encourage you, if you have any questions about a newborn being adjusted, what that entails, it's a very different process to evaluate and adjust a newborn versus an adolescent or of course an adult. If you have any questions like that, please don't hesitate to speak with your chiropractor. Understand if their practice is one that is able to see and help a child at all stages of life. We here at Chiropractic First of Rockford are passionate about it. So if you are a client with us currently or you'd like to reach out, please feel free to leave a comment, ask questions. We're happy to educate and continue to ensure that the health of your friends, your family, and the loved ones around you are healthy from birth through the end. Have a great day.